It is the final day of Summer Davos here in Dalian, but before we go, a quick but critical conversation on health systems across the world, where healthcare is headed. And with me is Andy Moss of the World Economic Forum. Thank you so much for joining us on WION, Mr. Moss. My first question to you would be, what do you believe would be the big takeaways from 3 days of intense discussions and statements coming out? Where is global healthcare really headed in the current scenario?
I think we find ourselves right now at a very unique time in health. It's a time where there's increased challenge, increased pressures on scientific research, pressures in terms of aging societies, increasingly a rise in chronic disease, and so there are workforce shortages, a lot of challenges that are very similar in different parts of the world. And so, but also we find ourselves at a time of opportunity. There's new technologies, new capabilities that are available that in many cases, organizations and governments are starting to understand what those capabilities are. Now the question is, can the models, incentives, and systems actually adapt to bring those new opportunities, those new technologies to bear in solving some of health's hardest challenges? And so I think here at the annual meeting of New Champions in Dalian, what we've really been focused on is what are the ways that we can exchange information about how to evolve and transform those systems. And one of the things that I think is a lasting impression, at least from my perspective, is the importance of long-term planning for health. Not just to prioritize it during periods of outbreak or disease or pandemic, but really to have a sustained focus on health on the mid to long term and what we can see in terms of those strategies bearing fruit, as we have, for example, with China's increase in clinical trials. That's the byproduct of many, many years of commitment and evolution and consistent policy and strategy, which health doesn't always enjoy that higher prioritization in all parts of the world. And so it's a challenging space, but one that is, like I said, rich with opportunity.
Well, you did mention being more proactive and not reactive when it comes to pandemics and other such situations. Has the WEF seen a change in its approach, especially after the COVID-19 pandemic? And if so, what would be that one outlier that stands out for you in terms of what we should be doing differently ever since?
I think there is a change in approach. I mean, I think many countries and citizens alike, felt the inequity of access during that period. And so at the forum, we've worked with our partners initially on the Regional Vaccine Manufacturing Collaborative Initiative, which was really looking at how do we in key geographies consolidate, bring regions together to potentially procure access to medicine or to create more local and more sovereign manufacturing capacity. And so we worked on a strategic framework and plan for several years with our partners. That is now being managed by an organization called CEPI, which is really focused on continuing that work of regional collaboration around vaccine access. In addition to that, through the forum's work on something called the Bridge Alliance, we're working to look at the inherent data that sits behind health surveillance and to have greater exchange between researchers. I mean, in a pandemic time, the one thing that you have on your side, hopefully, is time. And so it's critical to be able to share that data on a timely basis so that researchers can understand the pathogen, develop a medical countermeasure, and do that as quickly as possible to minimize the threat to human life. I would say what we're doing differently is recognizing the importance of health resilience, of really keeping our populations healthy to begin with. I think many of us saw during COVID, those that had pre-existing conditions, whether that be related to metabolic health or other things, that puts you in a much more vulnerable position in terms of your health and the risk to your health. And so I think many of us feel the need to live healthier lives and increasingly are looking to government policy, to the environment around us, and to the choices and solutions to be able to facilitate that. But we all know behavior change is hard, and making that transition requires knowledge, and it also requires access, and then ultimately it requires each of us taking personal accountability to make those choices that positively affect our health.
I'm glad you spoke of access, because that was going to be my next question. We've seen in several scenarios where access is not always equal or timely. And even though we see a lot of tech transformations, even in the healthcare sector, especially when it comes to research and development, all of those technologies really trickle down after a lot of months or years across the world, especially Global South, the African continent. What sort of policy change or outlook change are we looking at on that front to ensure that we minimize the gap between the West and the East?
I think it's access, it's equity, it's also about viability of the market and how you can bring together a set of policies to really increase the likelihood that you'll have access to these life-saving medicines. And I think many parts of the world, through various programs that we do at the Forum to help facilitate and strengthen regional competitiveness and innovation. And so where we're seeing progress is where you see a deliberate set of policies, a clear vision about what a country or geography wants. Oftentimes that needs to be matched with the values of its citizens, in terms of speed versus safety. I mean, each part of the world has a different view on that. It's important to respect the integrity of those decisions. But where we are seeing more deliberate policies, more consistent incentives, you're seeing an increase in access. And so I think it's right that each country and each region evaluate what is the appropriate priorities that they have, but most importantly, have a very clear vision, be working with the private sector to evolve that vision, and also, the incentives and market mechanisms that underpin that in a more consistent way, and not maybe falling to the temptation of more short-term, quick wins types of things when engaging, with industries.
Right. Speaking of India specifically, the country's been called the world's pharmacy for a very long time. But as health systems transform and evolve, how do you see India's role change as far as the global healthcare system is concerned?
Sure. Well, I think that, as you mentioned, as the pharmacy of the world, India has proven its ability to put in place, not just a manufacturing base, but an understanding of the research and development of the pipeline needed to be able to sustain that manufacturing base. I think the opportunity now, we've seen a lot of Indian strategies in terms of laying the foundation for significant advancements in health and leveraging not just data through many of the programs to create, a unified health record, but also to put in digital public infrastructure. And so a lot of those architectural plans are now coming to a point of maturity. The real challenge, I think, now is how do you build trust with the people that actually implement this, both the citizens and patients in India, but also the clinicians, the health systems that utilize those technologies and that data every single day. And so I think there is this heritage of success in terms of innovation within health, and now the real opportunity is continue to build the trust that's needed across both the government and the private sector contributors, whether those are Indian organizations or multinationals operating there, to really place India as one of the leading countries in terms of digital health. At the Forum, a lot of the guidance we've received from partners is that India is a place in the world where they want the Forum engaged and to have a high degree of focus because of exactly that potential. Not just to improve innovation, but really to do it at scale. And we feel that India has the opportunity to do both.
Right. And before I let you go, my final question to you would be, is there a conversation that is still happening on the sidelines in terms of challenges that the world healthcare sector faces that you would like to see become more mainstream? Any one thing that you're passionate about or that you think needs to be talked about more?
I think what needs to be talked about more is that health continues to maintain a place at the top of the global agenda. I think there are so many pressures with trade and geopolitics and other things that tend to press health down as a lower priority. I think the one thing I would want to say is, many of our partners want to champion the fact that, listen, you can't separate economic growth and prosperity from health. And without that, you really can't have that. And so putting a much more significant investment, viewing health as a dividend, as an asset, as an investment for your society, as opposed to an increasing cost, we feel that that paradigm shift is really critical for global leaders to continue to consistently invest and also put health in their long-term planning.
Treating health as an asset, definitely something that everyone across the world should be looking at. Thank you so much for talking to us here on WION.
That's my pleasure.
Thank you.